I'm curious about obesity and extreme thinness. Not during the transfer, but with a patient we collected eggs from, she weighed 165 kilos. We had a difficult egg retrieval. Yes, you remember as well. So how does the process work with patients like this? Because I heard you say during that transfer, or rather during the retrieval procedure, if she loses weight, I'll do the transfer.
I must have been upset.
Waiting and upset?
No, not at all. It's not about being upset, of course. But weight issues are a serious problem. Worldwide, it's an endemic problem and a situation that causes serious issues. Of course, as doctors, we always want all our patients to experience pregnancy and undergo IVF at their ideal weight. We want this from a technical standpoint as well, because the success rate of IVF treatments performed at ideal weight is much higher. But for various reasons, patients are unable to complete this process. But our time is also limited. Some women, for example, come in overweight with low ovarian reserve, while others are about to lose their reproductive potential, or they got married very late. So as we considered with this patient, we can first create the embryos and set them aside, and then have the patient go through a weight loss process so that they can come for embryo transfer at a weight closer to ideal or at a lower weight. Because we can preserve the embryos we create for years without any loss in their quality. What I'm trying to say with this patient is that once the embryos are formed, she will have very good embryos. And after the embryos are formed, the patient can reach a more ideal weight, which of course we have already started both her fertility treatment and her weight-related treatment at the same time. Or if necessary, if they are going to undergo bariatric surgery, we recommend that they have the surgery first and then try to get pregnant. This is not a situation we can provide for every patient. Sometimes, due to weight loss progress or treatment compliance, she may conceive while still overweight. For these patients, we discuss risks like lower IVF success, miscarriage, gestational diabetes, and hypertension, which can negatively affect both the mother and baby. It is not possible to make every patient lose weight, but we emphasize the importance of weight to every patient. When it comes to being very underweight, there are also different degrees of being underweight. Of course, patients who do very intense exercise and have a very low body mass index can also experience negative pregnancy outcomes, such as increased risk of miscarriage and increased risk of preterm birth. Again, in those who cannot menstruate due to disrupted ovulation, those who do intense sports, or those who are extremely underweight, such as individuals with anorexia nervosa, where thinness reaches a pathological level, having children can also become difficult because their ovulation functions are impaired. For them, it is significantly more advantageous and beneficial, both for the successful outcome of the entire pregnancy and for their own long-term health, to first address and treat those underlying health problems before becoming pregnant.